determine that you're dispensable, and we're going to reserve that for people that are younger. Now, Joe Barton, example A. 3.5 years ago, I'm in the basement of the Capitol and negotiating with the Senate on a health care bill, believe it or not, as chairman of the Energy Committee, and I didn't feel too good. So I went across the hallway to the office where we have a physician on call when the Congress is in session, and I walked in and said I need to see a doctor. And when I got to see the doctor, he said, "What's wrong?" And I said, "I think I'm having a heart attack." He said, "Don't kid about that." And I said, "I'm not." So he put me on the table and they gave me an EKG, and he said, "Congressman, you should have been a doctor. You are having a heart attack." Now, I said, "What do you think I ought to do?" And he didn't say, "Let me call the Health Benefits Advisory Committee." And he didn't say, "Let me look up what the Comparative Effective Research Council says for your age group and demographics." He said, "I think you ought to go to the hospital." And I said, "Okay." And then he said, "Which one?" And I said, "The closest one." So when I get to the hospital, they wheeled me into the emergency room, and the emergency room doctor takes a look at me and does a few more tests, and he says, "I agree that you've either had a heart attack or about to have a heart attack, and I think we ought to do a procedure on you to determine whether you need an open heart bypass or an angioplasty." And again, he didn't say, "Let me check and see if you're eligible." He asked me, he says, "What do you think? What do you think?" And I said, "Well, what if I say no?" And he said, "Well, you'll probably die, or you'll be impaired to such an extent that you won't have a normal life." I said, "Okay, what if I say yes?" And he said, "Well, you've got about a 95% chance, if it's what we think it is, that we can help you and you'll be okay. But there is a 5% chance that just doing the procedure to investigate, you could die." I said, "Okay, 5% chance versus almost certainty, I'm going to take the 5% chance." And then he said, "Who is your cardiologist?" And I said, "What is a cardiologist?" He said, "It is a heart doctor." And I don't have a cardiologist. Now, he didn't look up a list of cardiologists that are eligible. What my chief of staff said, and the reason my chief of staff was there, not my wife, is that my wife was in Texas and I was in Washington. So my chief of staff had come down, not in the ambulance, but in a car right behind me. And my chief of staff had the sense enough to ask, "Isn't this the hospital where Vice President Cheney was operated on?" And the emergency room doctor said, "Yes." And my chief of staff said, "We want him."
That's good.
And they called, and he said he would be happy to be there in 15 minutes. Now, the point of that story is that when I was in real distress, I didn't have to depend on all these boxes. I was lucky that I was in the basement of the Capitol, and there was a doctor with an EKG machine literally between myself and where that door is. Now, that was pure luck. And I was also lucky that because I'm a congressman, there was an ambulance outside the Capitol, that they put me in that ambulance and got me to this hospital within about 15 minutes. And I was also lucky that since they took me to the hospital, that it's the backup hospital for the President and the Vice President of the United States, that they had an emergency room and a protocol for taking care of emergencies very quickly. And I was unbelievably lucky that the heart surgeon that had operated on the Vice President he happened to be available and on call that night. But my point is, we don't need this bureaucracy. We don't need to be told. We don't need, in my opinion, to have unelected, non-medical professionals determine who is eligible and who is not eligible, and determine what the benefit package should or should not be. So it's not just the public health plan. It's all these other boxes and mandates that, in my opinion, would radically change healthcare as we know it today from a market-based doctor-patient, hospital, clinic, private sector model to the government, eventually one size fits all, and you really do have a government-run healthcare system. Now, if you think that government-run healthcare is the way to go, and some of you do, go to Canada, go to Great Britain, go to Russia, go to China, and you'll find out, even go to Great Britain, that there are waiting lists, that there's rationing, and in some cases, there's just indifference. We spend more as a nation on healthcare than any other nation. We're the wealthiest nation. We can spend less and have the same outcome, in my opinion. But because we do believe in a market approach as opposed to this approach, we have the highest success rates for various forms of cancer and heart diseases and diabetes and on and on and on. And when you look at the statistics, it is startling. If you have prostate cancer in the United States, there's a 99% chance you're not gonna die because of prostate cancer. If you have prostate cancer in Great Britain, there's a 20% chance that you're going to be dead within 3 to 5 years of diagnosis. It's just because of the way they do their national healthcare system, the waiting list and the rationing and things like that. So, in summary, I oppose this plan not just because of the public plan, but because of all these mandates, all these bureaucracies, and all these interventions between you and your doctor. I simply don't think that that's necessary. Okay, I'm ready to take questions. Start with this lady. Tell us your name, where you're from, and I'll go to this gentleman here in the blue shirt, and we'll just work our way around.
My name is Kathy McGuire, and I'm a special education teacher in Texas, and I'm
Great.
and while I'm not an advocate of, something like this,
Right.
I'm also not an advocate of what I currently have.
All right.
I had a knee transplant 7 years ago.
Okay.
Currently today, my medical expenses have increased to the point of this last IRS, payment time.
It's called taxes. That's the common term for it.
That is right.
Right.
So my expenses above the 7 to 8% that was wiped out is more than $15,000 a year now. So I am, approaching close to half of my rent home pay to stay alive. And while I understand this may ration us, I do have to let you know that the insurance companies, the hospitals, the doctors, the whole thing is severely rationed, because I don't know about you, and you very eloquently spoke and let us know humorously your story. But on the not humorous side, I can tell you that 11 months after applying for a transplant, getting a rejection letter from your insurance company isn't the same as getting them from your coach.
That's true.
And I don't know where the expenses are going to stop, or am I going to have to quit teaching and do something
Well,
else?
you are a teacher in the public school systems here in Texas, so you have some health care through the public health, public teacher, public school district. Yeah, okay. And you finally did get the transplant.
Yes, I did.
Okay. There's a little bit difference between a transplant, because the number of people wanting a transplant, I believe I'm correct, almost always exceeds the number of organs that are available.
Correct, and I will have to let you know that if you have to have a transplant, please pick kidneys, because it's the only entitlement, meaning that Medicare will also help cover it. But if you need a heart or anything else, the private pay system that we have now will tell you sorry.
But in terms of transplants, not